Okay, one more time. It's 4:01 and we're going to get started. Okay, so good afternoon. Welcome to Climate Health Action Talks or Chat. This is our third session of a climate health seminar series brought to you by the Climate Change and Health Hub here at the University of Alberta. The Hub fosters meaningful collaboration among researchers, communities, practitioners, and policymakers to deepen our understanding of climate health impacts and co-develop health-related adaptation and mitigation strategies. My name is Lindsay Komar, and I am the Research Director in the College of Health Sciences, an enthusiastic Hub member, and your moderator for this Zoom session. Before we begin, let us acknowledge the land we all share. The University of Alberta acknowledges that we are located on Treaty 6 territory and respects the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, who are the original inhabitants and stewards of this land. Furthermore, we are coming together as health professionals, students, researchers, and community members to do our part to understand and address the impacts of human disruptions to Earth's natural systems on human health and all life on Earth. So let's chat about understanding health when wildfire strikes. I'm going to introduce our panelists for today, and then I'm going to ask each of them one question, and then we're going to take audience questions from the Q&A in the last 15 minutes. So first, I'm going to introduce Air Forbes. Air is a PhD candidate in the Department of Renewable Resources at the University of Alberta. She holds a BSc in Forestry from U of A and an advanced diploma with distinction in Geographic Information Systems from the British Columbia Institute of Technology. She has worked for Alberta Wildfire in seasonal positions for 3 summers while completing her studies, most recently as a crew member with the Alberta Wildland Fuels Inventory Program. Her research applies spatial analytics to develop novel multi-scale approaches to understand wildland fuels and wildfire vulnerability. Next, we have Dr. Tara McGee. I think Tara's here, hopefully, perhaps under the name of Nance Price. She is a professor in the Department of Earth and Atmospheric Sciences at the University of Alberta. Her wildfire social science research program extends more than 25 years and includes studies on wildfire prevention, fire smart mitigation, preparedness, and evacuations. Since 2013, she has co-led First Nations Wildfire Evacuation Partnership. In addition to her work in Canada, she has completed research with international collaborators in Australia, New Zealand, Portugal, and the US. She and her team are currently working on several projects, including one in BC on public support for prescribed burning, and another on equity and wildfire evacuations. Our next panelist is Dr. Giovanni Ferreira. He is a professor and director of the Division of Pulmonary Medicine at the University of Alberta, who leads a team of experts in the field of respiratory disorders. His primary focus is on rare lung diseases, tuberculosis, and digital health trials. Dr. Ferreira also serves as the medical lead of the Digital Health Unit at the University of Alberta. This innovative unit was created to facilitate clinical trials using digital health tools, enriching traditional trial design with big data. With a wealth of experience in clinical trials and active involvement in scientific study groups, such as the Cochrane Airways Group, he is dedicated to advancing the knowledge and practice of pulmonary medicine. Finally, we have Dr. Jim Johansson, a registered nurse and assistant professor in the Faculty of Nursing at the University of Alberta. His clinical and research background is primarily in mental health nursing, including the mental health of incarcerated populations. Prior to his career in nursing, Dr. Johansson spent over a decade working in wildfire management in Alberta as a wildland firefighter, crew leader, supervisor, and educator. His current research focuses on combining his mental health expertise with his firefighting experience to examine the mental health challenges of wildland firefighters in this province. So let's hear from our panel of experts. I can't see everybody now, but Air, are you there? Okay, perfect. My first question is for you, Air. Given your experiences in research, what are the top 3 things that people should know about wildfire vulnerability in Alberta, and how can we manage risks to our communities?
Yes, thanks for your question, Lindsay. So I am going to share, I prepared just a few slides. Hopefully these come up without a problem. Excellent. So I just wanted to start by showing this figure. It's from the CBC, but the data is coming from the Wildland Fire Information System, just showing area burned across Canada so far this year. You may see some years that we remember, like 2023, when we had, I believe the term is unprecedented fire activity and extreme fire behavior, where we saw almost 16 million hectares burn in 1 year alone. Contrast that with the very, very bottom row there, that's 2020. We had less than a million hectares burn across Canada in 2020. So this isn't something that's happening every year as being more and more and more. It is something, though, that we are seeing extreme events more often. And 2025 is projected to be the second worst season in recent history. So we can see that because of this early spring activity, we're likely going to end up above that 2024 number. I also just wanted to talk a really quick Fire 101. Everything that I'm about to say is things that I think we already know in our heads, but maybe haven't thought about it. So in order for a fire to start, it needs three things. It needs oxygen, it needs something to burn, and it needs some sort of heat to ignite it. To put out a fire, you just need to take one of these away. If we think in the scale of a campfire, to take away the heat, you dump a bunch of water on it. When you take away the oxygen, you throw a bunch of dirt on it. To take away the fuel, you either let it burn out or you take the logs away. And when we scale that up to landscape or the fires that we're dealing with here in Alberta, there's other things that are in play as well. So we have topography. So where the fire can go is influenced a lot by topography. If there's hills, if there's rivers, if there's big lake features. So that's really important to where fires can happen. Fuel, of course, is also related to that. So is there a bunch of forest? Is it a bunch of fields? Is there a giant gravel parking lot? If it is flammable, that's important. And the weather is the thing that's really tying us to this climate change talk today, where the weather is influencing the flammability of that fuel. So there might not necessarily be more fuel than normal, but what is happening is this weather is modifying the fuel moisture in that fuel. And we all know this by building fires ourselves, is that dry fuel is more flammable than wet fuel. You would never try to start a fire with a bunch of wet twigs. Oops. And then lastly, to answer your question, the three things that I kind of zeroed in on are kind of related to that fire triangle. So what we know is that there are more days every fire season that can have extreme fire weather. So it's not necessarily that there's more fuel for why these fires are happening. It's just that the days that those big fires can happen are more often. We also have a lot of fuel in Canada, so about 40% of Canada is forested. And managing the fuels to prevent fire is really unsustainable from pretty much every perspective. It's not environmentally, economically, socially acceptable to just clear cut large swaths of forest in Canada. And lastly, one of the most important things that kind of drives this vulnerability of communities and forests and fire in general is that we don't actually know where, when, or if a wildfire is going to start. So we could have perfect conditions where we have extreme weather, we have tons of fuel, we know where there's lots of fuel, we know where the weather's going to be bad, but if no fire actually starts, then it doesn't cause a fire. And anyone who tells you that they can predict exactly where and when a fire is going to start is either needs to be the one holding the match or they're lying. If anyone, I'd welcome for somebody to prove me wrong with some magic AI that can tell you where lightning's going to strike. But yeah, that's one of the things that makes planning for fire a lot of uncertainty there. So that's all I had to share. And I will stop the share here and pass it over to, I believe, Tara.
Yeah. Thanks so much, Erin. That was super interesting. I feel like I want to talk to you more about this AI prediction stuff because I keep hearing the opposite of what you said, but interesting. So let's switch gears to Tara. Tara, are you here? I'm sorry, I couldn't see you before.
I am, yes.
Oh, perfect. So Tara, can you tell us what are the top three things that people should know about wildfire evacuation and response now that we have these increasing wildfires? What do we need to know?
Sure, I'll just share my screen as well, hopefully. Fingers crossed. People see a slide?
Yeah, that looks great.
Okay, great, thank you. Okay, So I'm going to very briefly present a few findings from an online survey that I completed a few days after the Fort McMurray fire in 2016, and also research carried out as part of the First Nations Wildfire Evacuation Partnership with First Nations in Alberta, Saskatchewan, and Ontario in order to identify those three things that people should know. So I'll start by saying if a wildfire evacuation is ordered, how the evacuation is carried out can influence distress for evacuees, both during the evacuation and long afterwards. Having insufficient time to prepare causes additional distress for evacuees. In Fort McMurray, for example, many people did not receive an official evacuation order, but instead left their home and community when they could see houses burning in their neighborhood, or when friends, family, neighbors, or colleagues told them to leave. Having little, if any, time to prepare meant many residents left the city without food, water, gas, clothing, medication, and other essential supplies that they needed as they were leaving and traveling to a host community, as well as staying away in a host community. If people do receive an official evacuation order, they often still have little time to prepare. So some people are told to leave immediately, and others are told to leave in 10 to 15 minutes. And of course, sometimes evacuations occur in the middle of the night, which adds another layer of complexity. And of course, there have been more recent examples of evacuees having insufficient time to prepare. So it is very important for community leaders to tell people to get ready well before there is a need to evacuate. The places where people stay during an evacuation, the host community, has important impacts on evacuees' experiences as well. In our research with First Nations, it was clear that being evacuated to an unfamiliar town or city will cause additional stress for evacuees, particularly for people who have never left their home community. Evacuees told us about having to adjust to the light and sounds of traffic at night in the city where they were staying. During the evacuation of Stanley Mission in Saskatchewan, which recently evacuated another of their communities, actually, I think they just went back yesterday or today. Evacuees who had experience living in a city helped others with tasks such as how to take a taxi and how to read road signs. Services provided in host communities can have positive or negative impacts on evacuees' experiences. Importantly, having accommodation that's appropriate for evacuees is incredibly important. One example, hotel rooms must be large enough and have adequate bedding for everyone. Appropriate food should be available for evacuees. And also activities should be organized for all evacuees, including children, youth, adults, and elders. Probably fairly obvious, but it's vital for evacuees to receive information about where they should go when they evacuate and services available to them. And while staying in the host community, evacuees should receive information, reliable information about impacts of the fire and safety of their home. In our First Nations wildfire evacuation research, there were many instances where rumors circulated via social media. This also happens more broadly. So having people who can provide accurate information was important. In some cases in our research, that was by leaders who stayed behind in the community. So this focuses on host communities and really highlights the importance of host communities to be well prepared. And last but not least, once people return to their home community, impacts continue. Loss of food during a wildfire evacuation can have considerable impacts. In Northern First Nation communities and other northern remote communities, food purchase is extremely expensive, and it takes time to replace lost meat. During our interviews as part of the First Nations Wildfire Evacuation Partnership, evacuees expressed their continuing distress over their experiences. In some cases, the community came together to have a feast when evacuees returned, but in other cases, there was no community gathering. So it is important to bring people together after an evacuation to provide each other with social support and have an opportunity to thank community members who helped. During our interviews, evacuees share their lingering stress and worries about an evacuation occurring in the future. You can see the second quote there that illustrates that. Thanks very much. That's it for me.
Thanks so much, Tara. I think it's sometimes we think about people are going to be evacuated and that they're going to be perfectly safe when we get there, but that's not always the case. I actually heard that of Jasper evacuees, there was no more room in their host community, and so many people had to sleep in their cars when they arrived, and that the wildfire smoke was so terrible that they were sleeping in unsafe conditions. So it's really interesting. So that actually kind of leads me to our next panelist, Giovanni. So Giovanni, given your experience, what are the top 3 things that people should know about the impacts of wildfire smoke to respiratory health? And what are some possible interventions?
Thank you. Thank you, Lindsay, and thank you, Shirley, for the very nice invitation. It is a topic that is very close to my heart. I have actually a few slides, if I could share my screen.
Oh yeah, Tara, if you could stop sharing, then Giovanni could share his slides. Thank you.
How do I find the stop sharing option?
It should be like a green, or it should be right at the top of your screen, a red button that says stop share.
Let me try like this. Can you see my screen?
Yes.
Okay, perfect. So this is the first slide that I want to show you, and you will ask me, what are you talking about? Well, you know, the lung is the largest surface of our body communicating with the world outside. It's not the skin, it's the lung. Actually, if we could flatten our lungs, that would be, the surface will be equal to an apartment of 73, 76 square meters. That's why you see this picture. And I want to show you this because it is important to understand how our body is working. So every time we take a breath, we actually breathe in and out almost 500 milliliters of air, okay? Now, think that we do this 12 times every minute, which equals to 6 liters of air every minute, 60 minutes per hour, so 360 liters. And at the end of the day, we have really... Can you hear me? Sorry.
Sorry, Giovanni, could everybody just make sure their audio is muted? Thank you.
Sorry about that. So at the end, in one day, we have actually used almost 9,000 liters of air. So to give you an idea, we will fill an Olympic pool of 200 meters Olympic pool with the air that we have breathed over one day. So that's very important to understand why wildfires matter. Already air told us about the wildfires in 2023. And just to give you an idea about how much we burned that year, the surface of forest that was basically blown away is exactly the same as half of my own country, Italy. Imagine half of Italy going burned in a summer, basically, how bad it was, right? And why it matters for respiratory disease and for our health in general, because when we have wildfires, wood burning, there is an aerosol basically of substance that is released into the air we breathe. And this aerosol is composed by several type of molecules and chemicals. You see here, this is a human air. And you see here, this is a fine beach sand, like just a grain. You see the size of the molecules that are produced during wildfire smoke. It is extremely small, and it matters because these molecules that we call particulate matter, 2.5 or 0.1, they can actually reach the deepest areas of our respiratory system. And where they caused an inflammation and then is leading to the problems that we experience, most of all patients with respiratory and cardiovascular disease. So it is very important to understand why wildfires and air quality do matter. And this is just to give you an example. I was coming back from a trip, and this is what I found when I landed in Edmonton, May 20, 2023. At that time, the air quality index was 11, so very high health risk for the and exactly for those phenomena that I told you about, increasing inflammation in our body. And these are data from the government of Alberta, publicly available. You can check, actually, the government of Alberta has very good resources online. You see this very fine line here at the bottom. This is considered the upper limit for PM 2.5 in the atmosphere, the safety limit, basically. You see what happened here in northern Alberta, especially around Whitecourt that summer. So from 9 microgram per cubic meter of air, it went up to 1600. You can imagine what it meant to breathe that air for the people living around that area. And this is exactly what I was telling you before. So these particles can get into our lungs, can trigger an inflammatory response that is actually affecting the most vulnerable populations, of course, causing, again, exacerbations of diseases like COPD and asthma, effects on the central nervous system. I'm sure that you have experienced yourself some headache those days that air quality was very bad in the city, as well as cardiovascular events. We know that, for instance, the number of strokes recorded during those days is actually abnormal, is higher than usual. So, and again, we're not talking maybe about somebody like the man in this picture, very athletic, but with a perfect health. But we are talking about the most vulnerable people, so children with respiratory or cardiovascular disease, and obviously elderly people that are affected by conditions of frailty, and again, respiratory and cardiovascular diseases that are more prevalent among this population. So, and the evidence is there. It's very clear that during days with poor air quality due to wildfires, we have a much higher number of people coming to the emergency room for asthma exacerbations. You see all ages, so children and adults, people with COPD. Now you see this is a little bit difficult to read, but basically when you see this diamond, if it was around 0, there will not be any risk added by the condition of having the poor air quality. When it's towards the right part here, you see that the risk is increased up to 10% totally when due to PM10 and PM 2.5, as well as by just considering the smoke in the air, not even measuring the particulates, and the all-cause mortality. Unfortunately, we know that people with chronic conditions, again, are more susceptible to severe conditions worsening and with a risk to be admitted to the hospital, and unfortunately also dying for this exacerbation. So what we can do, the 3 important things. First of all, to be aware of the risk. So again, the Alberta government has resources online that are very good. You see here, for instance, the Capital Airshed Alberta publishes every day, almost every hour, the air quality index, which is also relayed on the Weather Canada app, which is very good, I would say. When we have conditions of poor air quality, well, these are general recommendations, and I think everybody knows at this point. So to limit outdoor activities and strenuous physical activities as much as possible, stay home, close the windows, use any air filter you may have at home to reduce the particulate in the air you're breathing. So keep also, a good maintenance of all the ventilation systems at home. And then, of course, stay hydrated. And for the people with medical conditions, really, get the best up-to-date treatments because they reduce your risk of getting worse or getting exacerbated during those days, and be compliant also to the treatment. It's asthma is a typical example. If you don't use your inhalers, it's like not having them. So again, behavior, be aware, protect yourself from poor air quality days by staying at home and using protections, and take care of your condition. This is especially true for the most vulnerable populations, again, children and elderly with an higher prevalence of chronic disease. So thank you again for the invitation.
Thanks so much, Giovanni. Okay, and last but not least, we have Jim. An important aspect of wildfires that isn't talked about much is mental health. Jim, what are the top 3 things that you think everyone should know about wildfire firefighting and mental health? You just need to unmute.
I do need to unmute. I don't know how to use Zoom. Okay, so top 3 things that people should know about wildfire firefighting and mental health. So obviously we think a lot about the physical health aspects of wildfire, especially things like smoke. But thinking about how the mental health of people is affected by wildfires. So the first thing I want to point out is that mental health impacts of wildfire are widespread across many populations and areas. Thinking about Dr. McGee's discussion of evacuations and the significant impact and disruption that evacuations have on communities, and kind of the immediate and the long-term mental health aspects of that. Property loss, destruction, loss of personal items, important items, the disruption of routines, the networks that you have, do you going back to your community after widespread destruction, these all have a really significant mental toll on people. If we think about the forest itself, we think about this idea of ecological grief and the loss of forests. I haven't been to Jasper since it burned down, essentially, but people I know who have talked about just how significant the destruction of the forest is, and how that causes a lot of sadness and a lot of grief. And people who have really strong connections to the land, these can be disrupted by these wildfires. Obviously, wildfire smoke is something that we've all experienced in the last few years. And as we talk about the physical health aspects of this, but the mental health impacts of wildfire smoke are also quite significant. It can lead to a lot of isolation. So Dr. Ferrer was just mentioning, the importance of limiting outdoor activities and staying outside. But what are the mental health impacts of doing this? It's important that we stay inside, but what kind of isolation does this lead to? If we've got kids who want to go outside and play and they're stuck inside all day, if you don't have air conditioning and it's 35 degrees outside and the place is hot, these are all really mentally taxing on people. And if you think about all these kind of widespread effects of wildfire, these can lead to really not only short-term but long-term effects on people's mental health. This can lead to things like depression, anxiety, PTSD, substance use. And this is, I think, especially well demonstrated in communities where evacuations have happened, especially really kind of destructive fires and evacuations. So widespread mental health impacts, but I want to spend a bit more time focusing on the people doing the actual firefighting. So as was mentioned, I spent over a decade working in wildfire management before I became a nurse and focused on mental health. And the people who do this job, who are out there trying to keep fires small and put them out and keep them from burning down communities and creating all this smoke, so it's a very high stress, high danger work environment. It can be quite challenging. It can be quite fun and exciting, but it can be quite challenging. And unfortunately, there's a lot of accidents, injuries, and even fatalities that occur in this. We probably all heard about the fatality on the Jasper wildfire last year, which is very tragic. but fatalities happen all the time, unfortunately, and this is really stressful, obviously, and potentially traumatic to the people who work with those people who've lost their lives. There's this idea of losing fires. So firefighters, they have a lot of pride in the work that they do, and they want to go and they want to catch fires and stop them and put them out. But sometimes you can't. Sometimes you go to fires and they get away. You lose them is the language that gets used. And imagine being the firefighting crew that responded to the Jasper wildfire and losing that. And how that affects you personally, you know, thinking what could I have done differently, what could have happened. The work itself is long hours, there's long shifts. Your schedule is uncertain. Your days off may or may not happen. Technically, you can work up to 24 days in a row as a wildland firefighter in Alberta. That is a very hectic, long work schedule. I've done that before. It's not good for your mental health. Most of the people who do the firefighting itself are seasonal workers. They work for 3, 4, 5 months a year. They don't have benefits. Um, they don't have a lot of kind of employer supports for the mental health issues that do pop up. And this is really this is really kind of exacerbated in the off season, which I'm going to talk about in a second. And again, we see higher instances of mental health issues in people who do the firefighting itself. And this is things like PTSD, anxiety disorders, depression, substance use is also an issue in this population. The last thing I want to point out is that firefighters, they help each other out. This is an incredible space as well. There's a sense of belonging, sense of achievement. There's a lot of resilience that gets built into this, and this mostly comes from the peer support that exists within this group. This is an immense strength of these groups of people. But the challenge is what happens in the off season when you lose that support. And people might work for 3, 4, 5 months a year. They have this really tight-knit group of people that help them out. In the off season, they go home and they lose that. Maybe they go to a different province. Maybe they go to a different country and they lose that group of people who have been helping them out. And a lot of the more significant mental health issues that emerge with this group of people happens in the off season when they lose that support. And unfortunately, because they're seasonal employees, they don't have access to benefits in the same way that other people do. And this is really quite challenging for them. And this is something that needs to be addressed and something that my work is looking at. So those are my 3 things that I wanted to point out. Thanks, everyone.
Thanks, Jim. Okay, that was all so good. I'm really excited to hear from these panelists. So I think what we'll do now is take some questions from the audience. So if you have questions, Natalie, I'm not sure if we have, I saw somehow that the Q&A went out. Are we just using chat at the moment?
Yeah, if people want to drop their questions in the chat, that might be.
Okay, perfect. So while we're just waiting for that, so please enter your questions in, or you can also just raise your hand if you want to. I'm okay with that too. Do whatever works for you, but maybe I'll just ask a quick question while we're waiting. So I really have heard a lot, and I'm learning so much about this. It's so interesting about kind of like fuel and how that is feeding into all of this. And so what I kind of want to ask all the panelists is, should we be doing things differently? And is there, like, are there different approaches that we aren't using that we could? So I'm kind of thinking like, perhaps like Indigenous-led wildfire management. How could that be integrated into our current wildfire strategies? And how might that protect us, protect populations from the health risks of wildfire? And I know that might not be a question for all of our panelists. Sorry, Giovanni, if it's not for you, but yeah, just curious about that. And anybody can go ahead.
So I can't speak largely on the topic. There are many more people that are further qualified in terms of land indigenous fire use. What I can speak on is that as a whole, like keeping fire on the landscape is a positive, especially for lower intensity surface fire regimes. Unfortunately, in the boreal forest, we see a lot of very high intensity canopy fires, and no amount of underbrush burning can actually reduce the hazard of those really, really intense fires. But I think the use of prescribed fire, especially closer to values to reduce those smaller fuels, can definitely make a difference, as well as mechanical fuel treatments that have a similar goal, for sure. Jim, I saw you nodding your head along to that. I'm sure you may have some comments, but as somebody who's actually been on the fire line, did you have anything to add to that?
Yeah, and I can speak, having worked in Indigenous communities firefighting, and every spring we would go around and we would burn all the dead grass in the communities as much as we could, as much as safe to do. And I'd seen instances of where later on in the season, wildfires are approaching communities, and the burning that we did in the beginning of the season actually created safe zones from that fire and was protective. And I have a cat helping me out today, but so that prescribed burning, that low intensity underbrush burning is quite protective to communities, and this happens to begin with, and I think that there's probably opportunity to expand this.
Tara, do you want to add to that at all?
Well, my colleague would do a great job of answering that question, but I mean, there are a lot of nations that are doing cultural burning. There are a lot in BC in particular, but there are a lot. That's something that we see increasingly across in Canada. So yeah, it's something that we'll be seeing more and more, I think.
An interesting quick follow-up is, do we have enough Indigenous experts to make a difference? I don't know if any of you can answer that, but maybe that's something we can all just sit with. I'm not sure. Good question. Good research question. Okay, we do have a question that's for everyone on the panel. What does interprovincial collaboration on wildfires look like? What happens when fires and their effects cross jurisdictions? Do we have anybody who can answer that one?
I can do my best with that one. There is an agency, the Canadian Interprovincial Firefighting Centre, CIFC, that works to coordinate interprovincial and international sharing of resources and coordination on a very logistical level. I don't know how that works, but I do know that they will coordinate, if it's busy in Alberta, they'll coordinate people from Ontario or Quebec and all over Canada. And then, we see in the news folks from South Africa, Mexico. I worked with some of the Mexican firefighters back in my day, seeing them come up, and it is coordinated, and it's coordinated quite well from what I understand and what I've seen.
Maybe I'll add a bit in terms of wildfire evacuation. So certainly that always involves collaboration, whether it's between provinces or different levels of government. So municipality, provincial agencies, and also federal, if it's, well, typically, but also certainly when it's First Nations. So it depends on lots of factors, but I mean, typically there is that coordination between those levels, but there can be challenges as well, right? It's politics can come into it and pose some challenges, but often with evacuations, there is a lot of collaboration across different levels of government.
Even within the healthcare system, the Alberta Health Services has worked with Northwest Territories, BC community in BC in case of evacuations. It is always a stress situation, though. I mean, it's not, it's a situation where we would rather, avoid at all. I mean, we should probably take care of the problem to prevent it, not to, it is something we do, it is important, but um, it's positive for the people we work with, but it's a stress situation for everybody.
Yeah. And I was kind of wondering, this also probably doesn't have an answer. How ready to go are we, to deal with cross jurisdiction fire management, Yeah, interesting. The next couple questions seem to be for Giovanni. So one of them is, if you wear an N95 mask, can you go outside in wildfire smoke just like you normally would, or is this still risky for asthmatics?
So there are studies showing that N95 masks can clean up to 95% of the PM2.5 in the air. I'm not sure I would recommend it to my patients though, because first of all, you need to know how to use an N95 mask. It has to be fit tested, meaning adapted to your face, basically. And anyway, the risk will be always there. Also because it's not only the PM2.5, but it's also free radicals like ozone that are increased in the atmosphere during those days. So if it is absolutely needed, yes, that's something that can be done, but it is still not the normal, let's say. And definitely I will not recommend anybody to go out and exercise with an N95 on their face. Definitely not.
Okay, that's interesting. My friend just rode to work and it was like 13 plus smoke and he wore an N95. He's like, it was fine. So kind of a follow-up to that is, how safe is indoor air? Somebody's asking, would it make sense to outfit public buildings like community halls, malls, that kind of thing, with air filtration so they can be smoke shelters?
Yeah, that's a very good question as well. So again, it depends on the maintenance of the buildings. But if the ventilation systems are well taken care of and the HEPA filters are changed, and the efficacy is secured, actually it works quite well. There are studies showing that the level of PM 2.5 can be reduced between 40 and 80% in those buildings. And in fact, my colleague in pediatric respirologist, Anne Hicks, in the last years had an agreement with the Galaxyland at the West Edmonton Mall for kids. Instead of going to school, they will get free tickets to go to Galaxyland during those days, and it actually helped a lot to avoid, especially kids with asthma, to get sick during those days. Yeah.
Interesting. Okay, I think our next one is kind of more for air, but anybody can chime in. So does anyone have statistics on the leading causes of fire? Are they man-made, lightning? What can we do to prevent the frequency of ignitions? And air, if you want to talk a little bit more about that prediction bit, I would be interested.
Yeah, absolutely. So in terms of number of fires, so the number of starts, usually there are more human-caused ignitions than lightning-caused ignition. But in terms of area burned, lightning-caused fires account for the most area burned. That's obviously can be tied to the fact that when a human causes a fire, they're nearby to report it, or other humans are nearby to report that as well. So area burned by human-caused fires is usually a lot smaller. And the leading cause of human-caused fires, I think, is considered like a resident fire, which could be something like a burn pile getting out of hand, or and things like that. Another big player is like power lines. So a tree hitting a power line is also a human-caused fire, or sparks from a railroad, things like that. In terms of like things that we can do to change that, is the like classic smoky bear, only you can prevent forest fires. So we can absolutely reduce the number of fires every year if people are paying more attention, they're respecting fire bans. If you are using an ATV, you're checking your hotspots, things like that are really easy ways to prevent the number of fires from increasing and being associated to that man-made fire component.
Okay, thank you. So the next couple questions are a little more medical, so maybe for Jim and Giovanni. So medical services are always profoundly affected related to evacuations, might be Tara as well. Have any of you done any work on the impacts of fire on healthcare workers? Or what do you think those might be?
I've spoken to quite a few people within First Nations, of course, the healthcare professionals, it's quite a small group, and they do have incredibly important roles. So it might be going to a host community and looking after people there. They will often be able to identify the high risk folks, but I've never actually conducted research yet focusing on the healthcare professionals. But yeah, that's a great question.
I wonder, Giovanni, oh yeah, I was going to say.
No, I didn't see any specific studies on this question, but I can tell you that my interest for wildfires and respiratory health was triggered actually 2 years ago, because in the summer 2023, our inpatient services were full like in November, December during the flu season, you know? And traditionally, summer is a time of the year you expect the workload to be lower, health professionals to be away or to rotate, you know, to cover the services. So it has been a problem of, you know, workload and attrition of the staff for sure.
And a workforce that's still recovering from COVID too. Yeah. Okay, this next one is for Jim. They say, thank you, Jim. Very interesting talk. I wonder if you could talk a bit more about the burden of wildfire-associated mental health incidences among the general population in Alberta. So what types of population level or community-based support group interventions are available for the at-risk populations?
Yeah, it's not my specific area of expertise, but there is some good literature on how, you know, wildfire, especially smoke, really does affect the mental health of folks, and some of the things that I mentioned in terms of, you know, isolation, being stuck inside. And I think that community-based supports is finding creative solutions, like was mentioned about like opening up Galaxyland for kids, is finding these spaces that are considered safe or more safe for people to go, so that they're not so isolated. I think is a really important intervention, and identifying kind of safe places within communities for people to go and congregate and not feel so isolated. Um, but then also thinking about like some of these kind of most susceptible populations, you know, what if you don't have a home to begin with, and it's, you know, 11 out of 11 air quality outside? What kind of interventions and what kind of supports do we have in place for these folks? And that, and I think again, it involves on a community level, identifying spaces that people can go to get out of that smoke. And if we can do that and we can minimize that isolation and stress, the benefits to mental health kind of down the road should be mitigated, improved, I suppose. Yeah.
Thank you. Oh, this next question is so good because it comes from our our leader. What role does climate change play in wildfires in our responses and the health impacts? Anyone?
I
Sherry,
can,
you know, too. Go
you,
ahead.
you know, I can give you this example. So I was driving a few days ago, sorry, in the River Valley. It was very warm, air quality index between 8 and 10, and it was full of pollens from birches. And all these phenomena are related to climate change, because climate is global warming, is extension of the pollen seasons. Maybe now we're still in the early phase, but you know, we see in countries like Australia, for instance, that the pollen season has become 4-6 weeks longer than it used to be 20 years ago, and wildfire smoke. So that's the perfect cocktail for my patients to feel sick, because it's a lot of things in the air that are really irritating and dangerous. So is it a consequence, or there is a role of climate change in all of this? I think so. And I don't want to speak about the forest, how dry they are. Probably Air can talk about that much better than I do.
Yeah, I think that's basically absolutely the answer to the question. Is with climate change, we're seeing more days with extreme fire weather, which means it's hot and it's dry and it's windy. And when it's hot and it's dry and it's windy, that's a chance for any ignition to turn into a very large fire and grow fast. And if those fires are growing fast in your communities, that's when we're going to see the effects that are related to Tara's research.
Any more on that one, Tara? No?
Um,
Yeah, go ahead.
Just very briefly, with kind of more intense wildfires happening, I don't know if there's any stats on this, but anecdotally, I'm hearing this is that for firefighters themselves, these really intense fires are more likely to burn out really, really deeply into the ground and the root structures of trees. And there's been more and more incidents of falling trees landing on firefighters, essentially, and a lot of the deaths that have happened in the last few years have been attributed to that, unfortunately. Whether we can statistically link that to climate change, I'm not sure, but that seems to be anecdotally what a lot of kind of long-term firefighters are saying is happening.
Okay, I think we have 2 more questions, and then we're probably going to have to end there. So this one is a bit more about messaging. So how do healthcare professionals, the government, and media communicate the serious potential health impacts of wildfire smoke to a population that's already skeptical about public health messaging, as we saw during COVID? There's these perceptions of limitations to freedom that make people reluctant to adopt reasonable health precautions. So do you have any insight on that? Like, how do we message this?
I mean, I think that, events like this one are extremely important. Increasing awareness in the general population, but especially in the vulnerable subjects, is key to me. So, even again, my colleagues in pediatrics are doing a very good job with schools. And then the tools are out there, actually, because again, Weather Canada is an app that is from Environment and Climate Change Canada. It gives very nice feeds and push notifications whenever there is an health risk. So that's, I think, what we need to do. And again, for me, it is very, very important to act especially on the most vulnerable populations, because the acute effect of wildfires will strike them first. Then there are also chronic effects, but let's leave it there because it will be really complicated to speak about that.
Anything else on messaging from anyone else? Okay, our last. Oh, sorry, go ahead.
Sorry, just really to echo what Giovanni just said. I mean, there is a lot of research on that, but there are also a lot of really good apps and sources of information. And I think, providing easy to follow instructions on what people should do will go a long way for sure.
Yeah. Especially that N95 mask thing, because I think that, don't go out and go for a run in an N95. I think that's something that even a health professional like me didn't really know, that you shouldn't do that. Okay, final question. I think we're kind of getting close. We'll see how long this takes us. What actions can be taken to protect the most vulnerable? So maybe people like the unhoused or precariously housed during wildfires, and who should be a part of those collaborations?
I'll I guess, say something about this. So in terms of organizations that support the unhoused population or precariously housed would be crucial in terms of providing information, because just providing warnings would be very difficult in that situation. So making sure that there are strong connections with organizations that will know where people are and that sort of thing. So that's one thought. And who should be part of that? Really anyone who has responsibility for supporting populations such as this, I think, should be involved in the conversation.
It's tricky though. Yeah.
We had a wonderful example about this during COVID, right? Because we had the homeless population actually sheltered in places like the Edmonton Conference Center. Of course, it requires a lot of preparedness, commitment, and resources. So probably it's at the level of municipalities to identify shelters and ways to inform and attract these populations.
Yeah, and it's interesting opening those public spaces inclusively, because that hasn't always been done. Yeah. Is there anything else? We have 3 minutes left. Is there anything that we've missed, or that any last kind of points that we want to say before we go? And no worries if there's none. Okay. I feel like we've had such an interesting discussion today. There's so much to talk about in this area. Unfortunately, we're kind of out of time, and I feel like we could go on for a long time on this. I just want to say thank you so much to our panelists for sharing their amazing research and insights into wildfires and our health. And thank you to everyone who came today. If you're interested in learning more about wildfire strategy in our community, because I think we think of it a lot about wildland, but there's also wildfire risk to cities. And so there's going to be a webinar put on by the City of Edmonton, and it's called the Urban Academy Climate Resilience Session, Managing Wildfire Risk in Edmonton. So their expert panel is going to include Fire Chief David Lazenby, Ashley Hines, who's a project manager for the wildfire risk strategy for the city, and then also U of A's own Dr. Jen Beverly, who is actually Air Forbes. I think, right? Is she your supervisor? That's right. So she's an associate professor in wildland fire in the Renewable Resources Department. So that's going to be a really interesting talk. And their session is on June 19th from 12 to 1 p.m. And I think Nance is putting the link in the chat. Perhaps. Oh yeah, you did. Thank you. So hopefully we'll see you there. I'm planning to be there. And we really hope to see you at future sessions of our chat. And we also have some other stuff that's going to be coming up in terms of this wildfire project. So please follow our socials and check out our website. And we'll try to communicate as many all these events to you now that we have your email. We're gonna keep emailing you. And if you want to fill in our feedback forms so we can kind of keep improving these talks, tell us what you like, what you didn't like, what kind of topics you want to hear about, because we want to keep doing more stuff like this. So thanks again to my panelists. You guys were so excellent. And thanks so much for everyone for joining us. It was really fun.
Thanks, everyone.
Thank you.